This video will cover discharges and discharge summaries. At the end of a patient's frequency, they should have met their set goals and will hopefully be ready for discharge. If for any reason you do not feel the patient is ready for discharge, please notify the ATS office so we can request additional visits for the patient. Discharges will include a lot of information that is required for notes. Please reference the training videos for evaluations and visits to go over this information. When you are discharging a patient, you must indicate a reason for discharge in the patient's note. You must clearly indicate the progression from start to finish. Once you have filled out the necessary information for the discharge, put in your electronic signature, the signature date, and then submit the note. The next type of note is the discharge summary. Discharge summaries are used when you are not able to see a patient for a discharge visit. These are often put in when a patient refuses therapy or if therapy is discontinued. These are for documentation purposes and do not require you to go to the patient's home for a visit. As with all other visits, you'll want to make sure that your time is documented correctly and that your visit date matches your signature date as well as your target date in the chart. You will then document the reason for the discharge, current status, goals, summary and outcomes, discharge information, and care coordination. You will then input your electronic signature, signature date, and then submit the discharge summary. This concludes the video for proper documentation of discharges and discharge summaries. If you have any questions concerning proper documentation, please contact the ATS office.